HIV and AIDS for Health 301 by Sam, Brooke, and Anna.
So our lesson objectives are the progression from HIV to AIDS, how HIV/AIDS is transmitted, and risk factors that increase your chances of becoming infected, and the prevention and treatment of HIV/AIDS.
So HIV symptoms, acute HIV, 2 to 4 weeks after virus enters the body. Some may not even notice these symptoms, and they include fever, headache, muscle aches and joint pains, rash, sore throat and painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, and night sweats.
HIV symptoms, the symptomatic HIV. The virus multiplying and destroying the immune cells, symptoms begin to become mild or even chronic, and these symptoms are fever, fatitude, swollen lymph nodes, diarrhea, weight loss, oral yeast infection, shingles, and pneumonia.
So progression to AIDS, about 8 to 10 years after HIV virus enters the body, it then turns into AIDS. The immune system is so severely damaged from HIV that you're likely to develop more frequent infections or even cancers. Some symptoms of these infections or cancers include sweats, chills, reoccurring fever, chronic diarrhea, persistent white spots or unusual lesions on your tongue or in your mouth, swollen lymph glands, weakness, weight loss, and skin rashes or bumps.
How HIV is transmitted. Coming into direct contact with fluids from an individual with HIV is the only way you can get it. And these fluids include blood, semen, rectal fluids, vaginal fluids, and breast milk. HIV in these fluids must go into the bloodstream of an HIV negative person for this to occur.
Some risk factors are having sexually transmitted infections, unprotected sex, sex in exchange for drugs, abuse, or money, sharing needles while injecting or abusing drugs, and 1 in 7 people living with HIV are unaware of their infections, and you can see that in the photo.
Prevention and treatment. So for prevention, you're going to want to use condoms correctly, don't share needles, asking your partner to get tested before becoming sexually active, taking pre-exposure prophylaxis, which is medicine people at risk for HIV to take to prevent getting HIV from sex or injection drug use. Treatment is no effective cure for HIV. With proper medical care, you can control it. HIV medicine is called ART, and post-exposure prophylaxis is taking medicine within 72 hours of being exposed to prevent the infection.
So question number 1, how quickly after HIV enters the body does it turn into AIDS? A, 2 to 4 weeks, B, 5 to 6 years, C, 8 to 10 years, or D, none of the above. And the answer is C, 8 to 10 years.
All right, question 2. Post-exposure to HIV, you should take prophylaxis within how many hours? A, 12 hours, B, 24 hours, C, 48 hours, and D, 72 hours. The answer is D, 72 hours.
Question 3. How many people live with HIV and are unaware of their infection? A, 1 in 5, B, 1 in 7, C, 1 in 25, and D, 1 in 40. And the answer is B, 1 in 7.